Hello, my name is Bogdan Toia. I am a surgical trainee. Thank you for the opportunity to present this project on behalf of the team from UCLH. We have no conflicts of interest to report. Introduction. Telecommunication technology is established in various urologic settings. Patient preference, particularly during the pandemic, is an important factor to consider in planning healthcare delivery in the immediate and long-term future. This prospective study, conducted within a tertiary level functional and reconstructive urology unit in the UK, aims to provide insight into patient preference. Methods. We identified all patients with pre-standing clinic appointments within our department during a 3-week period between June 8th and June 29th, 2020. We included all patients with follow-up appointments and excluded new referrals. Structured interviews were undertaken, asking participants about their preference on telemedicine clinic appointments, face-to-face appointments, or whether they had no particular preference. Patients were subsequently asked an open question about the factors impacting their preference, and their responses were categorized into travel issues, communication issues, need for interaction with the surgeon, concerns about requiring clinical examination or other tests, and delays to appointment and waiting times. Results. A total of 183 patients were identified from the hospital waiting lists. 49 patients were excluded from the study because there were new referrals, could not be contacted, or declined to participate in the study. We included 134 patients, 94 of which women and 40 men, of a mean age of 53 years old. Table 1 details baseline demographic characteristics. Telephone clinics were preferred by 56% of patients. 27% of patients preferred face-to-face clinics, and 15% expressed no particular preference for any type of consultation. Age, distance from the hospital, and time to access the hospital via public transport did not differ significantly amongst the 3 groups of patients. Desire to avoid travel to hospital was the most commonly stated reason for patients who favored teleconsultation. On the other hand, most patients who preferred face-to-face consultations raised concerns regarding inferior communication between themselves and medical professionals in a teleconsultation setting compared to in-person consultations. At the moment, teleconsultations in our hospital are performed only via telephone calls. The relatively young functional urology and neurourology patients, mean age of 53 in our study, are more likely to be comfortable using electronic technology and video conferencing software. In the future, by incorporating video link technology and smartphone applications, we hope to substantially improve virtual communications and attract more patients who are initially resistant to telemedicine. To conclude, teleconsultations can be a valid alternative to traditional face-to-face hospital appointments and seem to be preferred by the majority of patients for follow-up appointments in a functional and reconstructive urology department. Improvements to delivery of teleconsultations are likely to attract even more patients in the future. Thank you. I look forward to your questions.